There is no other issue in the world that causes such suffering which can be improved simply by rethinking. This is a quote by Amanda Fielding advocating for the use of LSD and other psychedelics to treat mental illnesses. Hi, I'm Frances Gaskell, and today I'm going to be telling you about LSD, its history, and why it should be legalized for therapeutic purposes. For centuries, LSD, more formally known as lysergic acid dithylamide, has been used for treatment of many mental illnesses, including depression, addiction, and anxiety in those who are terminally ill. According to Wesley Thoracaffa, in his article, What Are the Benefits of LSD?, when LSD was first discovered in the 1930s, it was a mistake. The creator of LSD, Albert Hofmann, was searching for a cure for migraines. He accidentally dosed himself with the compound, and upon doing so, immediately set about trying to find a therapeutic use for it. It soon began being produced as a treatment for depression in the 1940s. Its primary use was by psychologists as a therapeutic tool. Many therapists found it to be an indispensable aid to help their patients have breakthroughs in their therapy sessions, allowing deep-seated issues to finally come to a resolution through LSD-assisted revelation and insight. Sadly, its use was short-lived. In 1971, Richard Nixon and his administration passed a law that started what would become to be known as the War on Drugs. These laws are what made psychedelic substances like LSD illegal in the United States, and other countries soon followed suit. This banned the use and research of psychedelic drugs. They were reclassified as a Schedule I drug, which means that they have no current medical use and are therefore 100% illegal. Before the War on Drugs, in the 1950s and 60s, there were many studies done on the therapeutic effects of psychedelics. According to a video done by the Discovery Channel, one study, done in 1969, found that when autistic and schizophrenic children were treated with LSD, researchers consistently found improved speech behavior, increased emotional responsiveness, happier moods, and less compulsive behavior. Now, you may be thinking, this all sounds great, but these are psychedelic drugs that we're talking about. We can't just be giving these to people. However, it's the belief of many physicians, psychiatrists, and scientists that we actually can if it's done correctly. The issues that I previously mentioned, namely depression, addiction, and anxiety, are issues that affect households and workplaces all over the world. So far, even with the extensive research into subjects, science has not found a miracle cure for depression, addiction, or anxiety. In fact, the treatments that are commonly used to treat these issues often have the opposite effect of what was intended, as they often cause insomnia, fatigue, mood swings, and suicidal thoughts. According to a Harvard Health article titled, What Are the Real Risks of Antidepressants?, many children are raised in households where one or more parents or members of their family are suffering with mental health issues. An article from the American Academy of Child and Adolescent Psychiatry, titled Mental Illness in Families, states that when a parent or parents of a child are mentally ill, there is a greater chance than usual that their child will develop a mental illness. As well, due to being raised in such a sometimes volatile and unstable environment. The chance of a child developing mental illness is especially high if the parent has, and I quote, an anxiety disorder, schizophrenia, alcoholism, or other drug abuse or depression. If you'll notice, every single mental disorder that I just listed is known to be treatable by LSD. How is it humane to discontinue the use of this therapeutic tool simply because of a stigma that recreational psychedelic drug users have caused? Now, of course, when talking about LSD as a therapeutic tool, one must understand that someone cannot simply recreationally take LSD and their mental illness will improve. For example, when treating alcoholism, when a patient uses LSD in a controlled environment alongside addiction treatment techniques, a patient is 25% more likely to recover from their addiction than a patient who did not use the LSD. This may not seem like a huge percentage, but anyone who has had to go through the agony of either suffering from addiction or being close to someone who suffers from it can testify that even that small percentage of a chance that it will get better is worth it. Another group of people that LSD could significantly help in treating is terminally ill cancer patients. For many terminal patients, palliative care is of the utmost importance to them, and it's been shown that LSD does help with their form of anxiety. Taking LSD can induce a spiritual experience for them, which often helps those patients deal with their psychosocial distress, often caused by the knowledge that their disease is terminal. LSD is classified as a Schedule I drug, which, as I previously said, means it is illegal 100% because there is no known medical use. Marijuana is surprisingly also classified as a Schedule I drug, even though studies have repeatedly shown that marijuana can help with medical issues such as sleeplessness and seizures. A video done by After School called "Could Psychedelics Be the Cure for Depression?" informs that in recent years, over half of the U.S. states and many countries have legalized marijuana for medical purposes because of the overwhelming evidence of how beneficial it can be. If that can be done for medical marijuana, why could the same not be done for LSD? Of course, there is a larger stigma against LSD than there is against marijuana, but there used to be a stigma against women wearing pants that landed above their ankles, and look how far we've come now. Overall, when all of the facts are considered, LSD, when used correctly, could be so beneficial to helping treat mental illnesses. The changing stigma towards the use of psychedelics as medicine, as well as the ever-growing amount of supporting scientific evidence, should urge the FDA to fast-track more psychedelics for treatment. The amount of which it could increase literally millions of people's quality of life is unfathomable. The use of LSD as a therapeutic tool could bring freedom to many who are experiencing the agony of mental illness.